Welcome to Indiana Newsdesk. I'm Joe Wren. Well, state health officials are continuing to focus vaccination efforts on frontline health workers and residents in long-term care facilities. But as Ethan Burks reports, the state hopes to have updated guidelines next week indicating who will be next in line for vaccines.
More than 75,000 Hoosiers have received their first dose of the COVID-19 vaccine, with most of the inoculations going to frontline health care workers. The state is telling hospitals to verify that they're giving the vaccine to the people identified as being most in need right now.
We continue to focus our vaccination efforts on our frontline health workers because they are at the greatest risk of exposure.
Weaver says by the end of the week, Indiana will have received 146,000 doses of the Pfizer vaccine and 152,000 doses of the Moderna vaccine.
While it appears that we have a lot of extra vaccine, that really isn't the case. We received a sizable initial shipment of vaccine, but our weekly allocations will be lower going forward.
More than 110,000 Hoosiers have scheduled appointments to get shots next week, and CVS and Walgreens have started administering an additional 40,000 doses for long-term care facilities.
I want to stress that we are moving in a very intentional order of eligibility for vaccine. We want to ensure that we have enough vaccine before we open up vaccinations to additional groups.
The state has created an online dashboard that tracks how many people have been vaccinated and will be updated weekly with the latest vaccine information. Weaver says in the next week, the state will be taking a look at the data and the number of doses available to determine what types of people are eligible for a vaccination.
What is the risk for serious illness and death in that population? What is the risk of exposure to COVID-19? What is the risk of exposing others, especially vulnerable people? And how much vaccine do we have available? And what is the safety and efficacy of that particular vaccine for that population?
And in the meantime, Weaver says no vaccines will go to waste, as local health departments should be on standby for more doses. For Indiana Newsdesk, I'm Ethan Burks.
Hospitals across Indiana can once again schedule elective surgeries. Governor Eric Holcomb announced 3 weeks ago that hospitals must halt non-emergency surgeries through January 3rd. Now the governor says after talking with hospital systems and seeing slight improvement in COVID-19 hospitalizations, he's ready to lift the ban.
But we monitor these numbers again every day, every week. And so while there's an executive order out there that goes 3 weeks, we're going to be reviewing this tomorrow and the next day, whether it's a holiday or not.
Holcomb's latest executive order extends gathering restrictions in counties experiencing the highest risk of COVID spread. Nearly half of the state is in that worst category. This week, the state recorded 2 new milestones. More than 500,000 Hoosiers have now tested positive for COVID-19, and the state set a new single-day record of new COVID-19 deaths. The state has confirmed about 8,000 total COVID-19 deaths since the start of the pandemic.